I'm Dr. JD McCoy in Gilbert, Arizona, and I'm happy to share some of my pearls relating to the latest in thread lifts for facial contouring. And what I'll say is some of the things that we're doing now were things I never really dreamed that I'd be able to achieve, even as much as 5 years ago, I'd say. But hopefully we get a few little different ideas from what I present today, and we'll have some time for questions at the end. So we'll get started. Go here. Okay, so you gotta love those Evian babies, and what they are doing is living a young life, and what we all want to do is live a younger life and add more life, more years to your life and more life to your years. That's me zip lining in Hawaii. I've had a lot of really cool experiences through my career. I've been injecting for over 18 years, and I've been doing thread lifts for a long time. But at the center of my training as a naturopathic physician is really trying to think very holistically, think about the mind-body connection. And when I first started practicing, I went gung-ho and thought I was going to change the world with mind-body medicine. And then you hit real clinical reality and things are a little bit different. But fast forward today, after incorporating cosmetic medicine as the primary focus of my practice, I can really say authentically that I change patients' lives every single day. And that's part of the purpose of what I'm doing every day at Contour Medical, my office in Gilbert. So what we're going to focus on as far as one of those tools is the thread lift. So before we're going to even talk about thread lift and some of the things with threads, I always like to include some information relating to facial assessment and treatment. And if you walk through my office, you're going to see lots of education relating to facial aging, the things that change in the face that, guess what, most of our patients don't really understand. These are processes that we understand, but we really want to let patients learn what's really going on with their face, because they usually come in focused on one or two little areas, and really we're thinking about the full face or the full body, depending on what we're doing. So for me, this is this rhomboid, which is a slanted square in front of the ear, is something that I talk a lot about in all my trainings, whether I'm talking about injectables or talking about threads. And I give kudos to Dr. Mark and Dr. Janine Kofert for helping me with this many moons ago. But really, when you look at the shift and change in the face, this preauricular space is crucial, both from a volume standpoint and for repositioning, because you cannot show me a youthful, beautiful looking face that doesn't have a good jawline. You can have other little faults in the face, but if you have a collapsed jaw, if you have a loss of volume in the periphery, it's a telltale sign of aging. The other thing to keep in mind is, years and years ago, patients would come in focusing on one little line, then it became two little lines. Now patients are coming in with multiple concerns, and they're slowly starting to get it that really we're talking about the entire face. So for me, it's really important to think about showing the patient their entire face. If you are still showing the patient a mirror to do your consult and assessment, that is $19.99. It is 2022 now. We need to kind of step up our game. It doesn't have to be 3D photography. That's my choice, my preference. I've been using 3D photography for a long time, and I think that that is a really powerful tool. And guess what? Within the next few years, everybody's cell phone is going to be able to do 3D photography. So if we're not using some sort of tool in the office to capture that, we're kind of missing the boat. The other thing is you really want to be able to validate your results. I'm going to show you before and afters and discuss cases, and I've got really good photography that we can validate and really show real change. I'm very critical because most of the before and afters that I see out there are pretty pitiful, and the lighting isn't consistent, angles aren't consistent, and really it's just not very good clinical photography. So that is my tool tip there. Show and tell. So with show and tell, I feel like the photography is an element of show and tell because you're showing the patient their face. The other thing with threads, and I encourage it with other things that you do in your practice, is to incorporate show and tell and let patients touch, feel the thread. They don't really understand what a thread is. They don't understand how strong it is. They don't know what it feels like, what it looks like. And what you do is you reduce a lot of anxiety when you let a patient touch and feel it. And I think on a certain level, it brings you back to childhood and how, for the most part, we liked show and tell. It was kind of a fun thing. So if we can incorporate that into our consult, I think that's really powerful. Really using 3D photography to show changes over time. One of the sayings I say in the office all the time is it's a marathon, not a sprint. Meaning you have patients that you're going to have with you for many, many years. I've got patients I've been treating for almost 18 years now. So you want to be able to capture that change over time. And I get so excited when I'm doing a follow-up and we're able to look at reverse aging, where you have a patient that's 5 years old. Both of these patients are 5 years older on the right. So you're capturing a change over time and you're showing like you can truly reverse age if it's in a tasteful way. So for me, using good photography in combination with a good consultation to put the best treatment plan in front of the patient. I use that word all the time. This is the best plan. Nobody wants an okay plan. Nobody wants a good plan. They want the best plan. So you always want to put that in front of the patient and authentically do that without regard to what you think would be within their means. Meaning I always kind of put price to the side and just try to put what I think is going to be the best and get the best outcome for the patient. And then let the patient figure it out afterwards. Because most of these things can be staged, so we can do this over time. So don't forget about your males. The men are very loyal patients. Men are not going out with other friends to do Groupons and to do discounts. They're very loyal and they like things that are a little bit longer lasting. So for me, the threads definitely check the box for that. Use male imagery. Don't forget about your men. Men want to look at male imagery to understand what's happening with the face. And guess what? The women like to look at the male imagery too. So you kill two birds with one stone. Okay, now we're actually starting to get towards the threads. So for me, I always want to reinforce, no pun intended, because reinforcement is with rebar right here, the importance of what threads are doing. And threads are like rebar. And when you're pouring concrete, it's the rebar that gives strength, stability, enhanced structure to the concrete. The concrete itself is your volume. It's the tissue. And you need to have adequate volume and tissue for the rebar to do anything. And it's the exact same with threads. So the way I frame it is threads are not a replacement for volume, but it will reduce the total amount of volume that a patient needs. So if a patient comes in and they have adequate volume, great, you can go right to threads. If they don't, we need to address volume. So one way would be considering using a temporary filler, something like an HA filler. And for me, it's really thinking panfacially, meaning think about the whole face. Because my argument is very simple. No matter how good an injector you are, if someone has volume loss in their entire face and you just correct one region of the face, no matter how good you are, it is going to look a little bit weird because you're not creating balance in the face. So for me, it's always thinking about the whole face. And what I would say that's imperative when it comes to thinking about threads and its interaction is thinking about that periphery and that preauricular space. And we'll get there in the cases, but that's the exact area where we're fixating our threads. So that's why it's especially important. So one thing to consider if you need larger volume, you can always do dilution of your HA. A lot of the manufacturers don't want to talk about this, but guess what? It works brilliantly. This is a powerful tool. You get very good duration, and guess what? It makes the product smoother, easier to inject, more forgiving, and it works really beautifully. Just do some of the math, 20 milligrams per mil. The rest of, and if you look at 1 gram of filler, 1 milliliter of filler, so that's 20 milligrams of HA, 980 milligrams of water. So when you change it to 10 milligrams per mil HA, doing a dilution, it's a very small shift in the amount of HA. You're still at 99% water primarily. So food for thought there. The other idea that I like to mention, because it's a big part of my practice, is using biostimulants. It blends nicely, especially with the concept of threads, because threads are biostimulants in themselves. So we have that option as a way to correct volume. So whether it's using Sculptra, hyperdilute radius, Bellafill, these are different options that are out there. We can do fat, Renuva. There's a lot of different tools in the toolbox. I just want to be on the radar screen. Okay, so some brief history. That patient is actually one of my very first patients doing threads many moons ago. That's using the curl lift technique. But I've been around with threads since using just regular nylon sutures, the Aptos threads, feather lift, contour threads, which were a permanent polypropylene suture, the silhouette threads, which were PLLA based, and then the PDO, which are kind of the go-to, the main tool in the toolbox. And with those threads, we have lifting and smoothing threads. And along the way, all of these PDO threads have really evolved, meaning they've changed as far as their delivery method, their tensile strength, their design. We'll review some of that, but that's really exciting. So that first thread lift I did was actually in 2005, and I actually was on Fox News presenting the case, and it was just ahead of its time. Nobody really understood the concept of thread lifting. But what's happened is, like a lot of things, it's come full circle, and it's very sexy, very popular now. So there's a lot more people doing threads than they've ever had doing threads. So it's a great opportunity. But I will say authentically, because I rank really high organically when you search for thread lifting, because I've just been doing it a long time. I would say close to 90% of the patients that come to me for a consult, I don't start with threads with them. We might work on skin quality, we might work on volume, and then it leads to threads. But that's just my patient demographic. It's going to be changing, different for everyone. The take home here, super simple. We've got all these different tools, but we didn't really have something to resuspend, to move tissue directly from point A to point B. And that's what we have now as a tool. So there's lots of different types of threads. Bidirectional are the most common. Those are the most used. So they have an area of lifting and an area of fixation. You can have unidirectional barbs, which means that they're going to fix in whatever direction they're placed, and that's going to provide a fixation. So those are common as well, but I'd say bidirectional are the most. Multidirectional, these are more of a fixation barb, meaning these barbs will hold everything in place. So sometimes I'll use these retrograde, although you can really use any of these threads retrograde, but typically that's going to be your best choice for a retrograde thread from my experience. And I'm almost always combining interior grade with retrograde. It's rare that I'll do just retrograde threads for holding, as far as your holding power. And then your smooth threads, we don't want to forget about smooth threads, more as biostimulant, superficial texture. If you have enough of it, you can get volume. But the one that I want everyone to pay attention to is the one at the bottom, which is your mesh fill thread, the mesh thread. That is actually the thread that got me interested in the MIRACU threads in the first place. I was walking past the booth when they first came out. It was their first meeting, and I saw the mesh fill, and I'm like, oh my gosh, that's innovative, that's novel. I want to play with that. So learning more about MIRACU, their threads were the first threads to get a clearance for the cannula with the thread inside of it, which is really important. And what's most important is, and I've used lots of cannulas, I'm sure everybody here has used lots of cannulas and needles. Well, DongBang, the Korean manufacturer that makes the cannulas and needles for MIRACU, is the largest manufacturer in the world. They've probably made billions of acupuncture needles at this point. They know how to make cannulas. They know how to make needles. And that is really important, because a really good cannula can make the difference of, smooth deployment, getting right in the plane you want to, making things easy and very time efficient as well. There's a larger inner diameter. The threads that they're doing are a molded thread, which is really important in it increases the tensile strength and the holding capacity, individually packaged and very innovative. So for me, I noticed very quickly when I started using the cannulas especially, and the needles for the smooth threads, that we were dealing with a better product. And, I've used a lot of different products in the past, and the product that I'm using 99% of the time is MIRACU at this point, because it's been delivering the best results for me. So the line thread is my go-to thread for lifting the jowl, for reshaping. This is, in my opinion, the most advanced thread on the market. There's nothing more sophisticated than it. But at the same time, the last hands-on training, I was able to teach a few new users with a model how to deploy and use that needle, the cannula, and the line thread. So for me, it's kind of reassuring that you can take a new user, teach them how to use what is actually the most complicated thread. They can be successful. And in my mind, if you can do that, you can really do pretty much anything. So the key here is we have an anchoring tip. Wherever that anchoring tip is placed and fixated, it is not going anywhere, the tip. But whatever is attached to the tip is, meaning it's got amazing holding capacity. You also have a very deep cog hook on that thread. So from a fixation standpoint, there's not anything that comes close. The strength on the thread, you can wrap a needle driver and pull on that thread and it is not going to break. So you can tie off the thread if you need to. And I do tie off whenever I get the opportunity to. So here's that mesh filler that I mentioned. So this is 16 smooth threads sewn together in a sock over a cannula. And what you're basically doing is you're injecting that mesh fill. So with one blunt tip, 21 gauge blunt tip injection, you're placing 16 smooth threads. And often I'll do 2, you'll see in the video. But what you're able to do is very efficiently to deliver a large amount of PDO that can create projection, can create a little bit of volume. And guess what? You can also fill the mesh fill. So you can attach a filler to the hub of the cannula. And as you're retracting and leaving the mesh fill in place, you'll see this in a video, you can inject approximately 0.2 cc's of HA filler. I love this. I use this all the time. And for a new user, someone that is totally naive to threads, or just wants to be able to incorporate something quick, thread-based to their practice, this is the way to start because it's really easy. So we're going to start the video here. So what I'm doing is I'm just loosening the tip, and now I do it even gentler than that. But basically, you've got those 16 threads that are sewn onto the tip. So sometimes they adhere to the end of the cannula, and you want to have it so that it pops off nice and easy. I've already prepped my entry point. That's the art of doing this, is just learning how to prep your entry. So then I just slide in that cannula. I put a tiny bit of numbing in there, so she didn't even feel that. And then you just hold the tip of the mesh fill. And as you retract the cannula, you're holding the tip and it leaves the mesh behind. So I'm just using an AccuVein to create a different insertion point because I'm placing a second thread. And that's just showing it close up because there's nothing more frustrating than creating a pilot and then going right into a vessel and giving them a big old hematoma. So I use my AccuVein so I don't do that there. So I inserted 2 mesh. So that was 32 smooth threads right in that area with very little trauma. Because if you were going to use a needle and insert all of those threads, you would cause a lot of bruising and swelling. Here I'm going to do the nasolabial fold with the same mesh fill. The difference is this is attached to a syringe. It's hard because it's low in the video. So I'm going to the end. I'm going to ask her to make sure she's comfortable, no pain. Hold the tip with my finger, and then I'm applying some pressure on the syringe, and I can feel the tip just kind of pop off as the filler is filling the mesh. And it's usually about 0.2 cc's, very gratifying. As you can see, that was a very quick procedure, so it's very easy to add to treatment, which is kind of nice because with threads, it can take a long time to do a thread procedure as far as you have some setup, you have a sterile field, you have just more working parts. So it's hard to just add on threads to a treatment. But with the mesh fill, if you are doing a procedure and you want to add threads for the brow, nasolabial fold, the other areas I do it is preauricularly, jawline. But most of the times that I'm doing it nasolabial and brow. It's very easy to add to a scheduled filler appointment. So it's kind of nice. Just some before and afters, more panfacial. I wanted to include because I always forget about smooth threads for the lips. So this is just using smooth threads, a patient that didn't want any filler. So just using smooth mono threads in the vermilion, in the body, in the barcode above. You can also use mesh fill. If someone needs a little bit more pop to their lip, you can use the mesh fill, just being mindful that it's a 21 gauge cannula. So even though it's blunt, you're a little bit more likely to have some swelling post-treatment, but really beautiful and easy to add on to treatment. Again, you might do less filler with a patient and use some smooth threads. My goal is probably not going to happen until 2023. I've been wanting to do it for years, is just like have two prices for lips, maybe 500 and 850, or choose two prices. And it's not based on a syringe of filler. It's based on, okay, what am I going to do? So you can do some smooth threads, a little filler, maybe do some neuromodulator, and that's kind of your lip package. I'd really love it if that was the direction that things went, instead of being commodity driven just by the syringe. But we'll see if I get my hopes there. So this is a thread case, but it's also a resurfacing case. So this wasn't all threads. And I also used the exosomes, the Benev exosomes with this patient during his recovery. But he wanted some repositioning of the jawline and needed some repositioning of the nasolabial fold because of the toast fat. So I repositioned that after the resurfacing. I also did some threads in his nose as well. So I need to add a picture, a side profile picture, because it's actually pretty nice because I built his nasal bridge. And that's one of the deciding points for threads in the nose is, for me, if someone needs a lot more help with the nasal bridge, the threads work really nicely for that. And I've not done mesh fill there, but I've worked with other doctors that use the mesh fill, and they do like it in that area as well. So that'd be something to consider. So this is a more current case, and this is using primarily the line threads. Those are my go-to threads, and I tend to use more of the 70 millimeter. So it's a 17 gauge thread. It comes in 70 millimeter and 100 millimeter. You can do the same thing with just a standard barbed suture. So if you haven't been taught the line thread with the anchoring tip, you can do everything with a standard thread, so like a forte thread or a standard barbed thread. But the advantage of the tip is especially for addressing the jowl and getting that lower jowl, which for me, I don't have, the majority of my patients are not super young. So as you have an older demographic in patients, the number one issue that you're dealing with is the jowl. So having something that you can target the jowl specifically. So at that distal point on the lower thread and the most superior thread, I'm using a thread that has that anchoring tip. And where that anchoring tip is placed, it is firmly anchored. So wherever you move that thread, it is going to fixate. So the key is having good fixation. So whether you have really good beefy barbs that are fixating, so if someone has good tissue and good fixation barbs, which the Elasti line thread has the most prominent fixation barbs I've seen out of any threads, or you can tie them off. So in this scenario, in this pattern, it's not the same for everyone, but the cases I'm showing you, this pattern works really nicely. You're getting multiple points of fixation. And I used to do many more thread deployments from the same point. But actually I learned from Dr. Richard Jin, who uses MIRACU, to add additional deployment ports and try to deploy more threads for more ports. And guess what? It makes a big difference, because what happens is when we are deploying threads, when we are creating a vector, so we have our vector, but we're not really lifting a vector. We're trying to lift the entire plane. We're trying to lift the entire flap of skin. So we talk about vectors, but at the end of the day, we're using those vectors to try and move the entire plane. So when you have more deployment ports, you have more points along the plane that you are pulling towards. The other thing that I do that is crucial is, and it's more relevant as a patient gets older, is I always want to make sure that there's not any significant adhesion along the plane that I'm trying to lift. So if you're trying to lift the midface, when you go into your port, you need to make sure that there's no significant adhesions of the tissue. So especially if someone has volume loss, they're going to have adhesion. So the two areas that you have the most adhesion is zygoma and actually on the frontalis. The temporal frontal suture line, you can go in with a little blunt cannula and it will be adhered down to bone. So if you're trying to lift that plane, you need to release it. Just like a surgeon releases a plane and subsises a plane. We're not subsizing, but we're releasing. So I think that that's really important. That's a beautiful result. Look at that. Look at that V taper, that reshaping. I can tell you, after 17 years of doing thread lifting, I never was able to achieve that with any of the previous threads that I was using. Meaning the key in this case, in my opinion, is having that line thread that I can target that peak of the jowl. And if the jowl is pretty bulky and it actually extends under the mandible, then I will go below the mandible, because you need to target the bulk of what you're targeting. So it might be below the mandible. And wherever you place the point, that's where you're lifting. Where all the other threads that are cannulated, the thread is wrapped around the cannula. So you actually have to go a little bit beyond the point that you're trying to lift. So the line thread, the elasti line with the anchoring hook, you're going to target the specific area you want to lift, whereas the other threads you're going to go beyond. So another example, very similar vectors in these cases, because you can see they actually are kind of similar faces, but beautiful result as far as lifting a heavy jowl, reshaping. Look at the difference in her chin area. I did not do the neck. This is all from lifting the midface. And having those 2 points, so you have an inferior point and a superior point, both going to the most inferior point. That is key. So if you can do that, my impression is every time you're able to do that, you're able to get a really significant change in shape. Really, really powerful. Very, you're truly it's not just thread lifting, you're truly facelifting at this point. And doing some repositioning of tissue along the jawline, repositioning some of that nasolabial fold by repositioning the medial cheek. Really powerful and really high safety regardless of the skin type that you're treating. So where this not only is sexy, so threads have become very sexy, very popular, but the whole kind of world of regenerative aesthetic medicine, meaning that's a term that we start, a few years ago, it started being talked about more. And I got really excited because a lot of these things are things that I've been thinking about as a naturopathic physician for, 2 decades. It's kind of crazy. I go to meetings now, and at the meetings, there's IV centers that are doing Myers cocktails infusions and things like that at the meeting and talking about incorporating that in practice. I was doing that 20 years ago. We used to do it as medical students. We were doing Myers cocktail as an example. But just at the end of the day, it's recognizing that the body has an innate healing power and an innate ability to produce collagen and create a phenomenal wound healing response. And we can incorporate these things that kind of marry really well with that concept, whether it's volume through HA, whether it's a biostimulant. the threads themselves, the PDO hydrolyzes. And the thing that's kind of cool is as PDO hydrolyzes, because of where the barbs are formed, the collagen actually is formed in a helix. That's pretty cool, because what actually happens, and I've seen this in patients, is their result can actually improve over time. And it's not because collagen is being formed, but it's because a helix is forming, which actually shortens the strands. So those threads that you've laid down, the collagen that forms is actually shortens a little bit. Kind of cool. Just like when you take a thread and you twist it, if you're twisting a thread, you're shortening the thread. That's what you're actually doing. You could be locking it in place, but you're also shortening it. And thinking about the environment of the patient. So the environment, both of where you're placing the thread, is there adequate volume? Is there adequate nutrition? You know, my patients that are hormonally optimized, eating well, they do better. You know, they see a more robust response. It's pretty consistent. So some little pearls, creating a plane for the thread. This is crucial. I learned this from Dr. Pierre Fournier back in 2004, because he taught me his curl lifting technique. He invented liposuction. He wrote the first textbook of liposuction, and he had a technique of placing a nylon suture using a special blunt cannula. But he talked about how important it is to do just very gentle subcision to make sure that there's no adhesion so that you can create a plane. So whether you use a 18 gauge blunt cannula, if you have a infusion cannula, there's different tools that can be used. I can always help with some details related to that. Another pearl is using a dermoscope or some sort of magnifier. I use that all the time just to check my thread deployment sites, because sometimes you can't see it with your naked eye, but up close you'll see that there might be a thread extruding through your deployment port. That's the most common issue that you're going to run into post-treatment. A patient coming back with irritation because either the thread is poking out, it hasn't been buried and trimmed, or there might be a hair that's going into the port. You can deal with that on the table at the time of treatment. And especially with smooth threads, really important to look, because those smooth threads are the size of a hair. If you don't look at it under magnification, you might miss it. So if you take a few minutes, it doesn't even take a minute, it takes a few seconds to literally look with the magnifier. Putting some silicone sheeting or a steri strip over your deployment ports, really, really helpful. Because again, that just helps for a nice healing. Most my patients that come back, I do a follow-up at 1 week, and most times the insertion point is not even visible. Occasionally, some patients will have some difficulty healing, but for the most part, I say 95% of the time, it's scarless and really well healed using really good scissors. There's nothing that drives me more nuts than dull, crappy scissors. Have really good scissors so that it's super easy to cut the threads. You can undermine and create a little pocket if you need to. Make sure that you have good scissors, and then obviously an artistic touch, which, you know, I think pretty much anybody that's interested in doing threads and incorporating this into their toolbox, you know, it's artistic. This is incredibly artistic. I show you all these vectors and we talk about all these techniques, but at the end of the day, there is that artistic component, and what we're trying to do is elevate our art. That's me on a thread in Maui doing some zip lining. Need to get back to that. I haven't done that in a long time. So we covered a lot of ground in a reasonable amount of time. So hopefully it gave some pearls to everyone out there. And I think we'll open up to some questions if there's any, because I know this is all clear as mud. Or if someone has answers for me, I'll take that too, if there's no questions.
I have a question. Did you guys hear me?
I can hear you.
Yeah. This is Dr. JD. I'm from Little Kentucky. A question. Are you familiar with the mint threads, and how do you compare those two?
Okay, so I've used hundreds of mint threads. I don't know if I could say thousands. I'd have to go back and look. But I actually attended the very first mint training, and I went to their second mint training. And I'd authentically, before I used MIRACU, my go-to thread was the mint thread. And I would say my opinion and the opinion of a lot of other users would say that the Mint threads and MIRACU threads are both the best threads that we have available. For me, the thing that differentiated, the biggest thing for me is innovation. Like I want to work with a company that is really innovative, one, and I want to make sure that obviously the product is good. So a lot of it, the thing that was so different about Mint was the strength, the tensile strength of the thread. You know, Mint threads were like the first threads other than like polypropylene threads that, you know, I could tie off. They're super strong. But the MIRACU threads are stronger and they're more versatile with their cannula development as far as deployment through really good cannulas. And the mesh fill, I use a lot of those. I'd say at the end of the day, you know, use both. I was just doing hands-on demo with a group of physicians, and you know, some of us were using both. Some prefer Mint, some prefer MIRACU. The best thing is to get your hands dirty a little bit and play with them and try them, and compare. The biggest differentiator, though, for me, like that would make it very hard for me to give up MIRACU is what I've seen with that elasti line thread. Because that anchoring hook at the tip is just so powerful, not just for the jowl, but any area that you really want to target. And I haven't seen that. I wasn't able to achieve that with the Mint threads. And there might be ways to use it in that fashion, but that'd be my opinion.
Thank you.
Dr. McCoy, there's another question. Someone said, you mentioned with the elastic line, you use 2 per vector for lifting.
I'd say it's not necessarily cookbook with that. I'd say I like to have at least 2 line threads going to the most distal point. But some people, if they've got only minor joweling, they might only need 1, but I prefer 2. And I prefer multiple ports of entry. And I'd say the general rules would be kind of simple. I should probably create a slide like this. So I would say two threads to the jowl or to the point that you want to lift the most. I would say as many ports of entry as possible. So I would prefer 3 over 2 and 4 over 3. And I would say ideally to have a point going from the most superior to the most inferior as one of those line points to the jowl. And I'd say tie off if you can. It's not mandatory to tie off. And that's only because those line threads, and I encourage you, if you have to look and feel the barbs on that line, it's really, really substantial. And your amount of lift and fixation, so lift and fixation and duration, how long it's going to last, is directly proportional to how much PDO you're delivering. So the molding, all of that's important, but to a certain extent, at the end of the day, how much PDO is being placed. That's why the mesh fill, like for a brow or the nasolabial fold, is really powerful, because you're actually inserting a fair amount of PDO in a very efficient way. Does that help?
The same person, the next question is also mesh can be used for commisure and marionette lines.
Yes. Yeah, like it can be used for, you know, essentially any area you see a shadow. You know, if there's shadowing or a fold, it can be placed. I tended to highlight where I use it the most. But I've seen it used tear trough, marionettes. But me, I prefer to kind of lift, because the marionette isn't truly a defect of the fold. It's a defect of ptosis of the midface for the most part. So I'd say you want to make sure you lift the jowl and the midface and then address the marionette if needed, but it can definitely be used there.
Thank you. What thread type pattern do you prefer for tech neck?
For tech neck. Okay, so I don't think that that's an easy fix just with threads. Probably the best thing that I've used for tech neck would be RF microneedling. But doing a star pattern of lots of mono threads and then using forte threads to lift to the periphery. If there is a prominent platysma involved with it, then you can use the line thread and capture the superficial platysma. And that works really nicely. Again, the best results I've seen are with those line threads, but it's largely patient selection. And the RF microneedling that I'm using for the neck there would be the Silpharm X. But any RF microneedling will work. It's just a question of how painful it is for them. So I could, out to the side here in my office, I have my old Intracell, which has not seen the light of day or been plugged in since I started using my Silpharm X. So
right. So the next question would be, when you just need to improve the nasal bridge, where do you place the entry point and what length of thread do you use?
Okay, so it depends on the nose. So I'll sometimes use an inferior entry and I'll just use my AccuVein, choose a little entry point, just a little lido with epi for an entry. Sometimes it makes it, I'll use a superior point if I'm going to be treating the glabellar area and the nasal bridge. So that's usually how I decide. And remember, this is so the mesh fill, if you're doing mesh fill, it's on a 21 gauge cannula. So very safe. So the only thing you have to be prepared for is a little bit of swelling, but generally the swelling looks really good. And high margin of safety, because with the 21 gauge, if for any reason, if you were ever intravascular, which I would think would almost be impossible with the mesh fill tip on there, but if you were, you're going to see a flash into the hub, so you're not going to have any issue of putting mesh intravascular. And then the needles, if it was PDO, it's not really a safety concern other than swelling and bruising.
Thank you, Dr. McCoy. I'm actually curious about this question as well. Have you have any experience using mesh on temples where you need some volume to lessen need more filler? Yeah,
so I do that, and usually I do that if I'm correcting the brow, and if there's pretty significant hollowing above the brow. So the way I describe that is just like a pretty significant shadow off of the orbital rim. So what I'll do is from the same entry point, you can place the mesh in the brow, and then you can fan the mesh laterally into the temple region. So, and I don't fill it, but you could fill it. The issue that you'd run into is you kind of need to look at, okay, if you're going to put, let's say, 6 mesh fill here versus just doing some periosteal filler. You kind of weigh that. But as a general rule, if there's some pretty significant hollowing, your better bang for your buck is actually going to be the mesh fill. And I'd venture to guess, even if you did fill it, because you're not using a lot of filler, because this can be a pretty big hollow to fill with filler sometimes, depending on the patient. And the mesh fill is pretty nice for that.
Would you also use the mesh fill in the temple area with Sculptra or Radius?
I would feel comfortable with that. Again, what I'd probably do it a little bit differently. I would probably inject the Sculptra first. That will get the area very numb, and it'll give a little bit of projection. But I would not overcorrect, and then I would soften the shadow with the mesh fill, because Sculptra is not really precision driven. So for like softening a shadow, for being precise like the mesh fill would be able to, because you can really lay down the mesh fill exactly where you want the projection. So that's how I would do it. And probably the same thing with the diluted radius if you were doing that.
Thank you. So this will be the last question. How long do you wait after threads are placed to do RF microneedling? Will it dissolve thread?
That's actually a really good question. And that actually came up recently on a panel discussion that I was on. And I've always, in the practice, I've always waited 4 weeks. But there's actual data showing that we should be waiting 6 weeks. So there is literature published that actually looked at timing of RF microneedling and thread lifts, and the ideal time to wait was determined to be 6 weeks. So I'm changing that that policy in the practice right now. So that's the most evidence-based we've got.
Got it. Thank you, Dr. McCoy, for sharing your expertise on facial contouring in the latest thread lift discussion. And I appreciate everyone joining this evening. Dr. McCoy is one of US top powerful thread lifting providers with over 12 years, right, Dr. McCoy?
Yeah, over 12. I did my first in 2005, so pretty long time.
Yeah, experience who has treated a large number of patients through this door. We hope that all enjoyed learning more about how to deliver beautiful results using MIRACU products, as well as what they can expect when we first starting out treatments with regenerative aesthetic medicine overall. So please keep us posted if there is anything else BNF team could help answer.